Neuropathy is disease of the nerves, but typically when people talk about neuropathy, they're referring to peripheral neuropathy. Peripheral neuropathy is a condition where the nerves furthest away from your brain get affected. They get affected for a variety of different reasons. Could be diseases like diabetes, alcoholism, or even infections. But these nerves that are furthest away from your brain, which is the center for all nerves, the nerves that are furthest away from your brain initially get affected due to the lack of nutrients that have to travel all the way to these distances. So diabetic neuropathy or alcoholic neuropathy essentially begins with people feeling numbness in their feet or hands, sometimes difficulty walking, and sometimes sensory changes. Peripheral neuropathy needs to be worked up from a medical standpoint to identify what truly is causing this disease. Once that's done, there are many treatment options, which include something called neuromodulation, where there's electrical impulses used to reduce pain, medications, and interventional therapies. Now, in addition to peripheral neuropathy, you can have something known as an entrapment neuropathy. This is the second type of neuropathy, which essentially is a condition where these nerves, as they travel the distances of our arm or our legs, get compressed by joints, either the elbow or the wrist, the knee or the ankle. Now, if a nerve is compressed at the wrist, it's a very common type of compression or entrapment neuropathy known as carpal tunnel syndrome. There are different names for these entrapment or compression neuropathies depending on the location, the elbow, the shoulder, the knee. And at these points, tests such as electromyography, tests such as MRIs, and a variety of other tools are used to identify these diseases and treat them. Now, another type of spinal nerve entrapment takes place when the nerves exit the spinal cord. They get trapped in the vertebral body due to stenosis, which means narrowing, or the reduction in height of the vertebral segments due to spondylosis, which is essentially degeneration. Now, as these nerves travel out of the spinal segments, compression of these nerves can cause symptoms of sciatica or radiculopathy, as we refer to it in medical literature. So radiculopathy or sciatica is a symptom of stenosis and a symptom of a nerve being trapped as it exits these vertebral structures protecting the spinal cord. Treatments for that include medications, therapy, behavior modification, and even injections of cortisone in the form of epidural steroid injections. So neuropathy is a very broad term used to describe any type of disease of nerves. But it is up to a physician and the patients to try to figure out which type of neuropathy we're dealing with, come up with an appropriate treatment plan, and help alleviate pain and suffering for those dealing with these conditions.